With the arm in this position, I'm going to ask you just to gently bend the arm. I'm going to take the weight of the arm. It's very important that this is passive, not active. And we're going to take that arm in small circles, but gently increasing into circumduction. And this just loosens up some of those manipulated tissues that we've been on, and it just sort of dissipates some of the fluids that we've been working on. And again, just nice and slow, rhythmic, and just allow the arm to rest on the side after that. Now I've performed steps 1 to 3 3 times. So steps 1, 2, 3 times in total. And you know you've done enough when the band at the side of the arm softens. Each time we do the sequence of steps 1 to 3, you should feel these nodules that are embedded up the side of the arm soften, and by the third time it should feel much looser in this sort of lateral upper extremity. So in step 1, we're going to work up the arm in the fascial plane of the arm, and the first way we're going to do it is just in the center of the arm, upwards towards the acromial process. Now, the technique is upwards only. The reason is that we're stimulating the deltoid isometrically by doing that. And note that how I'm fixing. I'm holding her wrist in this position just to get a little bit of leverage, and then I'm just working through gently and slowly up in this direction. Good. One direction only. Nice slow strokes. As you work towards the top, you'll feel certain knots as we're coming up. So what we can do is we can just pause on those knots as we come up. And as we come towards the top, you'll feel a much sort of more focused sort of band or taut band of knot just as we come to the top there, which we'll hold. Now we're going to try generating a little bit more force, a little bit more velocity. We talked about this earlier in the course. So the modification I'm going to use here is to use my elbow. Again, I'm fixing here, but holding back. If you want to lean a little bit more, you can fix with your abdomen, and we're just rolling up a little bit deeper. Don't forget, the deeper you go, the slower you go, and we're fixing on those knots there. That's great. Breathe it through. Wonderful. As we approach the upper sort of all the way up to the clavicle, and we're fixing on those knots there. That's wonderful. I'll do that 3 or 4 times, but in between each of the deeper ones, I'm going to do a little bit more of a general one, just to ease through some of the toxins and the lactic acid that we've just made. Don't forget, what we're trying to do is to stimulate the deltoid and work on this fascial tethering all the way up the upper extremity. Again, I'm fixing on the arm. I'm going to work this time towards the back of the fascial tethering. Now you'll need to do this with a posterior case, and as we come up here, you'll feel that the tethering, the lump, the sort of condensation of the fascia is much more towards the posterior aspect. It's not in Kathy at the moment because she's not symptomatic in that area, but you'll definitely feel that there. So again, we're just working with some gentle pressure, but we can generate more force. And I'm going to work upwards towards the back of the shoulder there, and pause just in the rotator cuff quadrilateral space there. With a really tough biceps tendonitis or a really nasty anterior case, what I find useful is to work a little bit more to the front of that fascial tethering. So again, you'll feel the band up here, but you'll feel that approaching it slightly from the anterior aspect is a bit more beneficial. So we can either do that with the thumb as an applicator here, or fixing on the arm, leaning in a little bit with the elbow, coming just to the front of that band. Yeah, actually, that you felt that there. Get you to breathe that through. and working to just to the front, and then you can come into the trigger point just at the front there. If you need to generate more force with a really complex or a stuck case, you can use a two-person technique, and my colleague James is going to help me here. And what we're going to do is we're going to ask James to hold on to the wrist here and pull down a little bit that way, so it gives me some distraction of the joint. And again, from here, and if you do that with two hands, it's probably a bit easier. What I want you to do is just to sort of find the center point. Just close your eyes and just feel through it so you've got it. And from here, then I'm going to apply a little bit more force onto that upper extremity, and it's a kind of balance, sort of a bit of a tug of war between the two of us, but obviously bearing in mind this is for a really encapsulated case where you can feel that you need to get a little bit more force in. And again, we're just going to run up the joint and pause a little bit underneath. Here we're going to drop the arm off of the bed. Now, it's important that you do that passively, take the weight of the patient's arm. Some patients, if they're very acute, won't be able to do this. If they can, it's a very good sign, because it means that you're onto a pretty straightforward case. If they can't, then what you can do is you can get the patient's other arm and ask them to hold it like that, and just take it as far as you can. But if I go through the technique, and we'll show you some modifications afterwards. So let's pop that down there again, thank you. That's great. Okay, so step 2, I'm going to drop the arm off the bed this time. Just going to expose the axilla there. And what we're looking for is a trigger point in this zone, in this zone here. In this zone here. So again, I'm going to hold the wrist, and I'm going to use my my elbow just to generate the force. This is a really key step in the technique, because this works through the teres minor, a little bit through part of the rotator cuff. And what we're going to do is hold that spot there. Do you feel that one there? Good, and get you to breathe into it and breathe it through. That's it. And again, we're going to hold that trigger point until it relaxes, until it gives. Get the patient to work with some breathing. That's wonderful. Really got it there. Wonderful. Good. Now, it's important when you come away, if someone's really acute, that you tell them that you're coming away. So I'd say, okay, we're just going to come away from that one there. Just think about your breathing. Sometimes it goes into a little bit of a spasm when we come away, so let's just make sure we do that properly. Sometimes if someone's got a bilateral frozen shoulder, it can hurt on the other side, so you have to be careful in the way you sequence it. And again, with the modification, we can just hold it there, and just as we come away, just say to you, just let yourself prepare as we come away so it doesn't go into a spasm. The other thing is, when you bring the arm back towards the body for step 3, you have to be really careful, because you've already changed some of the neurology. So we're just going to really gently bring it back there onto the side. Okay, my colleague James, would you like to come and join us? So I'm going to ask you to come and kneel down on the floor here. Thanks. With step 2, you may want to generate a little bit more force, especially if there's a severely encapsulated or a diabetic patient. So this is a two-person technique. We're going to let that one drop down there, and what I'd like you to do is to distract the arm in the same way we did before. Careful of your wrist hold, that you're not pulling too hard, but we're going to come, that's it, down there. So this exposes, you can actually modify also the rotation of the wrist there a little bit, so that's it. So by internally rotating it, supinating it, we can come a little bit deeper and pull down a little bit harder. You got it, that's it. So we've got distraction, and I'm pushing it back against it. It's a really effective method for getting a little bit deeper in. Thank you. So some of the things I'd like you to think about are this, is as we drop the arm down, if you want to expose the axillary trigger point, the step 2 trigger point, you can adjust the rotation of the arm that's hanging down. Sometimes we can bring it all the way into pronation, and come a little bit deeper into that trigger point. And sometimes when you're on the trigger point, you can just start adjusting and playing with some of these points just to get the right spot. And when you've got it, then you can fix on it there. Okay, so now we're going to look at the lateral trigger points, and we've discussed these at length in the course. Again, a modification really of step one with some cream. What we're going to do is just work up, fixing the wrist here, work up in one direction only, upwards, but the idea really is to hold the lateral trigger point, and what that point is the nodule just beneath the acromion process, and you'll feel it's like a pea-like nodule, and we're going to sort of hold there and compress through it. So that my direction of force is going downwards towards the bench, and we can generate more force down this way. So I'm looking to really push it down and to almost distract it at the same time. Again, if you want to use a little bit more force, you can fix it there and distract, pushing downwards towards the bench. Don't forget the structures that we're looking at here are sort of the adhesive bursitis, or sort of subacromial bursitis, is probably somewhere about 1 to 2 centimeters deep inside here. So we're really looking to get a shearing force going through that trigger point. Now we're going to look at the lateral trigger points. Again, we've discussed this in the course. This kind of part of the technique you can do pause after doing the step one, or after you've done step 1 to 3 3 times. And the point we're after is just under the acromial sort of just under the acromion, the tip there, and you'll feel it's a pea-like nodule that comes under here. So fixing with the arm here, I'm going to trace up again slowly, but really what I'm looking at is to sort of fix on that trigger point there. My direction of force is downwards through the couch, and I really want to compress, distract, and put a kind of shearing force through that glenohumeral joint. Effectively, the tissues we're looking at, the subacromial bursa or the subdeltoid bursa, lie about 1 to 2 centimeters deep here. So what we're trying to do is to come in and to sort of really shear and distract through and get some energy, some momentum into that part of the glenohumeral joint. Again, you can pull a little bit harder just to get that force, and you can feel that there. And we're just going to pause on that really. Now sometimes I'd rest on for this point up to sort of 5 to 10 minutes. This is especially if someone's got very limited abduction. Good, thank you.